Hello again, Dr. Chris over at Health First Wellness Center, and welcome to another Wellness Wednesdays. Today we'll talk about the GLPs, Semaglutide and Tirzepatide, and why they're used for weight loss. Well, why would anybody use GLP for weight loss? Well, the obvious reason is that what the GLP is a hormone within the pancreas, helps the islet cells to produce insulin. The insulin helps get rid of glucose, which is sugar. Well, why do you want extra sugar in the body? Well, the obvious is more sugar in the body means increased belly fat, which down the line will lead to obesity. Left untreated, what does obesity lead to? Type 2 diabetes. Really untreated after years, all that weight gain, obesity can lead to cardiovascular disease. Not to mention, all that extra sugar in the body will also lower your immune system. The more sugar, besides chronic disease, your immune system gets lowered. A little side note there. That's why between Thanksgiving and New Year's, around that time, while a lot of people get colds and flus, get sick, that is because not only overeating, but the extra sugar they're taking in, the cookies, the cake, the pie, the ice cream, all of that sugar lowers your immune system, so you're going to get sicker more. Okay, that's why that's the time of year that happens. Now, when you take the GLP and you activate those islet cells, okay, your gut's going to metabolize better, your overall metabolism is going to speed up, and important thing a lot of people don't want to talk about is that the GLP will send a signal to the brain so you don't overeat. Okay, as we get a little bit more down the video here, yes, both the Tirzepatide and the Semaglutide, the weekly sub-Q injection, which will go in a minute, okay, helps you lose the weight. But when you retrain the brain with the Semaglutide and you put people on a diet plan, the exercise, they will by nature not overeat. So also, like I said, the holiday time, it's a great time to get started. When you start going on the GLPs before the holidays, you won't not overeat during the holidays, so you won't gain the weight, and eventually you won't get sick because you want all the extra sugar in your body with that. Now, how do we tailor these GLPs at Health First? Well, I mean, some it's priced too. We have the Semaglutide, Tirzepatide. We'll go over that, when you tell Health in office. So we'll go over the price point for people. We're upfront with that. But like I said before, once you find out what's going on, there's sub-Q weekly injection. Try to have the patient do it same time each week. Okay, and we check in with them via phone or text. We check monthly, see what's going on, and then we go from there with the patient with the program. Okay. There are no membership fees. It's very important, and no starter fees. The patient just pays as they go with our program. As the patients, when discussed the doctor in the clinic or on telehealth, when they reach their target goal, as we'll know what the patient wants, we'll talk either about tapering down or maintenance, and that's discussed, as per doctor, as per individual plan. Okay, so come check us out at healthfirstaz.com or on YouTube at Quest for Knowledge 33. Have a great day.